Hello, my name is Priyanka from Let's Update Language Academy, and this is
I'm Jasmine.
one of our students from Let's Update Language Academy. And here we are to present a role play card, and this is an interesting card. In fact, it's actually of a 75-year-old, and are concerned because the patient have recently been diagnosed with troubling getting into the bathroom quickly enough. So the patient cannot go to the bathroom quickly enough, and he finds that incontinence of often going to urinate, feeling like urination. Okay, so this is actually the condition of the patient, and I said it interesting. It's not because of the condition, but the patient is quite embarrassed.
Yes.
Okay, so the nurse has a role to console the patient as well as to make them comfortable. So here, the nurse's role will be played by Jasmine, and I'll be doing the role of the patient. So shall we start?
Yes, ma'am.
Okay, so usually we have 3 minutes as a preparation time, and here we are right away starting with the role play card. Okay, you may start, and here is the card.
Okay, thank you, ma'am.
Okay,
Good evening.
good evening.
My name is Jasmine John. I'm one of the registered nurses working in this local clinic.
Okay,
For my documentation purpose, could you please tell your name and age, please?
my name is Priyanka, and I'm 75-year-old.
Okay. So, could you please tell me the reason behind your visit, please?
Well, I'm here because I'm quite concerned that I've recently have been troubling getting into the bathroom quickly enough. So sometimes I have accidents and wet myself. It's very embarrassing, and I thought I should get some advice.
I really understand your situation, Miss Priyanka, but nothing to be overly concerned about your condition. You are in the right place. Sir, I will definitely give you some suggestion in order to get rid from the symptoms. So, can I proceed with that?
Oh, definitely.
Okay. In order to get a clear picture of your condition, could you please tell me when you have started with these symptoms?
This problem started, I think, a few weeks ago.
Okay. And how many times in a day you are going to go to the washroom?
It happens a few times a day.
Okay.
Yeah.
Have you noticed the amount of urine that you are passing?
Well, I should say it is enough urine, which makes me uncomfortable.
Okay. So have you occurred this previous before?
No, it hasn't. Before I never had this problem.
Okay, thank you for your valuable information, Ms. Priyanka. Now I will have to get some idea regarding your bladder habits. Do you have any noticed any changes in your frequency of passing urine?
Yes. I think these days I feel like going to bathroom very often.
Okay, have you experienced any pain while you are passing urination?
I haven't had any pain.
Okay, thank you for that. So I have to get some more idea about your general health. So can I proceed with that?
No problem. Please continue.
Do you have any history of bladder conditions?
I think I'm generally healthy, and
Okay.
I do not have any past bladder conditions.
I'm happy to hear that you didn't have any past history of bladder conditions. Okay. And have you experiencing any current infections or constipation?
I'm very pretty sure that I do not have any infection or constipation.
Okay. Do you have any long-term medications?
I'm only taking medication for high cholesterol, nothing except from that.
Okay, thank you for that. Okay, there are some common reasons for incontinence such as infection, constipation, and there might be some irritation due to the diet. The bladder will be irritated. So these are the main reasons for the incontinence. So I didn't find anything in your condition. So we will move forward the recommendation of the doctor's appointment. So he is the authorized person to give an exact diagnosis for you. Am I making sense to you, Ms. Priyanka?
I'm sorry to say, but I do not want to explain all these to my doctor because, as I mentioned, it's quite embarrassing to explain to everyone. So I hope that you can just give me some advice to manage this condition.
I really understand your situation, Miss Priyanka. The doctor is the authorized person to give an exact diagnosis for you, and the doctor can perform some physical examination, and he can order some blood tests and the urine sample analysis in order to get an exact diagnosis for you. So I think that will be the better option for you. So is that okay for you?
Okay.
Okay.
All right.
Do you have any other concerns to clarify, Miss Priyanka?
Well, in that case, I think I'll make an appointment with the doctor as soon as possible.
Okay, that's a good decision you have made, Miss Priyanka. And I assure you that your condition is very common and there is no need for embarrassment, and that this condition can be resolved immediately. And I will advise you to take some pelvic muscle exercises. And after this conversation, I will definitely provide one brochure which includes all these exercise patterns, and you have to follow scheduled toileting in order to control your bowel and bladder habits. So is that okay for you?
Yeah, definitely.
Okay, so we have some incontinence pads that is available in pharmacy. You can use that, so you will get an exact idea about how much urine you are passing in a day, and we have to find the exact cause for that.
Okay.
Okay, please make sure that you are avoiding caffeine from your diet. If you are taking excessive caffeine, that may also getting a chance of getting this incontinence.
Okay.
Okay, and please try to make sure that you are taking increasing your water intake properly, because as we have mentioned, you have incontinence, so there might be getting a chance of dehydration. You have to avoid that. So please try to make sure that you are taking adequate water in a day.
Okay.
And please please try to avoid double voiding. I have to mention the double voiding, such as passing urine more than once in a day, so you will get more comfortable with that.
Okay.
So am I clear to you?
Yes, that's
Okay.
pretty clear.
Okay, do you have any other concerns to clarify?
Well, no, it is clear.
Okay, I hope that you are ready to make doctor's appointment. Am I right?
Okay, I'll go for that appointment.
Okay, thank you for your patient listening, Miss Priyanka. So I hope I have cleared all your doubts. If you have any other discomfort or any other feelings, please come and meet me here. I will definitely help you.
Thank you so much.
Thank you so much, ma'am.
Okay, so that is the end of the speaking session. So she spoke very well and she was very confident in the content that she spoke, and a few things that you can note down to have a better performance. Okay. So like you have covered all the points which was mentioned in it. So as I said, the patient is quite embarrassed. Okay, again, the first thing I would like to notice the pronunciation of embarrassment. Okay, it is embarrassment. I think you said embarrassment.
Yes.
Okay, so I think this is for all the students out there. So you can say it as embarrassment. Okay. And then that was, I think, a slip of tongue. And then what I have noted here is a few, I think one tense mistake that you didn't have instead of you don't have. Okay. And you said that you have already mentioned me that I have to see the doctor. But I said that I do not want you to explain all these things to the doctor again. So you said I do totally understand your problem. And you didn't add a connective, but I'm sorry, you will have to meet the doctor because doctor is a professional who can take care of you. Okay, so a connective somewhere I thought was missing in when you spoke in one particular area. Okay, and tone wise, you could have made me little more comfortable with the empathetic tone. Okay, the language sentence structures it had, but from the expression of verbal expressions, I thought it was missing a bit. A little tension I could find in your voice. But apart from that, you were really good. As I said, you covered the content and also you improvised with the extra information, and you were giving me certain information which it can be useful for me. And the last bullet point was filled with information. So you used a variety of structures like please make sure, it's very important, I strongly recommend you. So such usages were really good. Okay, so there were certain strong points that you have, at the same time slight points which you can improve. Okay, so this is all about this card. So this is one of our students. So every students might have some or small mistakes when they present a card. It has to be rightly pointed out, and correcting it in the right time would definitely help them to improve a lot. So this is Priyanka Bratas
And Jasmine John
signing out. Bye-bye.